Hey, Angelique.
Hey,
Um,
Toby.
Welcome to our show, Office Hours. We're going to discuss all things Chinese medicine. How you doing?
I'm doing pretty well. Thank you
Okay.
for asking. And how are you?
Everything's going pretty well with me, thanks. Okay, I want to get started with some numbers. Are you ready?
I'm ready.
The numbers are 33,364, 1,300, and 1,000. What these numbers are in 2023, that was the number of active LACs we had in the US, 33,364. Um, and that's the latest data we have is 2023. We're recording this in 2025, but we don't have any data up till then, uh, anytime after 2023. And the other numbers I gave you were from 4 years prior to that. So starting in 2019,
Hmm.
we were actually adding 1,000 acupuncturists per year, but losing 1,300. That's on average for those 4 years. But we were
Wow.
having a net loss of 300 acupuncturists per year. It's even more grim for California, where I'm practicing. The last 5 years, again, starting in 2023, so back to 2018 for 5 years,
Hmm.
California acupuncturists, we lost 37% of our active acupuncturists. We've been having, we lost our major journal, probably our second journal only to the Journal of Chinese Medicine, the Lantern in
Hmm.
Australia, that closed down. The school I did my master's degree in closed. The school I did my doctorate degree closed. So it seems like always when I was first learning Chinese medicine, it seemed like such a expanding profession. And
Hmm.
then based on the last couple of years, it seems like a little bit contracting. I know you're a recent graduate of NISA,
I am.
and yeah, and you're going to Taoist traditions
Yes,
for your doctorate.
I am.
I wonder if you have any sense about these. You're so much closer to these institutions than I am now. Any sense about them?
I'm surprised by the numbers that you shared, actually, because my sense was that I'm based in Massachusetts, and it appears that the profession, at least here, seems to be growing. With Taoist Traditions being a smaller school, I think the cohorts are smaller. My doctoral program, I think there's 18 of us total, but I understand that might be large for a doctoral program. So, yeah, I'm surprised to hear that. Who's collecting this data?
This was a PubMed article. What I'll do is I'm going to put the link to it in the comments for this class for this discussion we're having, so
Hmm.
people can look at the data themselves. But
Okay.
it was a well-established study, and then it looks like I said, it looks like it's starting to trickle down to our journals and even our schools and things like that. At least on the West Coast here, maybe that's a little bit different for the East Coast.
Yeah, I'm not familiar with school closures out this way, but I honestly haven't paid that much attention, at least in this part. When you're in school, you're kind of in it for the duration of the 3 years and then so on. So that's unfortunate to hear. I hope that's turning around since that's older data, I guess.
Yeah. And then it seems like more and more, it seems like more and more Americans getting more and more open to coming to acupuncture. I started a little over 20 years ago, and it seemed like
Hmm.
people were a little bit reluctant, and now it seems like that resistance is gone. So, anyways, just a little bit concerning about. I noticed this. I read this article about that, and I was just wondering what you felt on the ground. So that's great. You're not really feeling anything on the ground. And same thing for me in private practice. It seems like busier than ever. Anyways, it's interesting. We'll watch on that. And then
Yeah,
we'll see, especially 2023, maybe effect of COVID or something like that. Less people wanted to go to school
that's
or
true.
something. So let's see. Let's see where everything goes forward.
Yeah. I hope it tips in the other direction if this is the way we're trending.
I
I
love
feel
this
like we're
prof.
needed.
Yes, I love this profession. So it made me a little bit nervous reading that.
Hmm.
Okay. Um, I know that you're a new practitioner.
Hmm.
You just got your license and it's still a little warm from hanging it up at your office.
Yes.
How's that going being a brand new practitioner with your first office?
It's been a very interesting process. I've been a nurse a long time. I've got over 2 decades of nursing experience. So taking care of patients isn't new to me, but certainly running my own business is new to me, and Chinese medicine is new to me, practicing acupuncture and herbs and all of that. So it's been a pretty large learning curve, but I'm getting there. I opened my clinic. I got my license in October of 2024. when I opened my clinic in December. And it's now where are we? Almost end of February. And I've got a pretty steady trickle of patients coming in. I went from having 6 to 26 due to advertising in a local newspaper in the form of having actually someone come out and do an interview with me. And that article seemed to resonate with folks in my community. Forgive my post cold resolution voice. And so folks have been coming, and I've been so grateful. I'm also paneling with insurance companies. And so that process is a bit arduous, but the approvals are coming in for that. And I have folks that are finding me on their directories. I actually had a phone call today from someone, a voicemail asking about insurance coverage as they saw that I was a provider in their directory. So I think that's helpful, especially as a new person in a fairly saturated area with acupuncturists, getting your name out there.
Yeah, I think that's fantastic. I think that's such a quick jump start. So I'm really happy about that. So besides the newspaper article about you and then insurance, anything else you're doing to let people know you're available?
Yeah, I started out with word of mouth, essentially telling the network of nurses that I knew and friends and family and having them tell people. And that's where my small little initial cohort of patients started to show up. And I did a radio ad with a local radio station. And they were great. I only had gotten one phone call, but I live in a small hill town area in Massachusetts, and I had heard other folks like through the grapevine that had heard my ad, but it didn't yield as much, it didn't yield anything really, like a phone call. But it was someone who was seeking an insurance plan I hadn't yet paneled with. So the newspaper is the way to go. New clinicians do it. Grassroots.
This is so great. Ancient medicine, so we got to use ancient modes of communication,
Yeah.
newspaper and radio, right? Real 1950s strategies.
Well, I found that the Google SEO really, with all of the things of starting a business, I was like, I don't have the bandwidth to learn one more skill. And so I have turfed that to maybe future advertising. And I've got classmates that have helped point me in the direction of maybe how to do that in the future. But for right now, I was like, I can do the grassroots thing. I can do the newspaper, radio interviews, and we'll save more of the tech stuff that has an additional, you know, books of learning for later on.
Yeah, but you'll see, right? I mean, especially you get some good clinical results early on with that first cohort of patients, right? Then that's really getting the ball going. I think the
Hmm.
hardest part is getting it going, so you may not even need that the tech part.
Yeah, it's super scary, when you're on your own, coming right out of school. I'm sure you remember, you're used to having supervisors to consult with and sort of having that safety net that's there that's like both comforting and annoying. Like, why do I have to check with them? Well, of course I have to check with them. And then that goes away. And then you're on your own and you're standing there in front of your patient for the first time all by yourself. And they've given you this highly complex presentation. And you're like, oh my God, what do I do? And then you
Yes,
do something and it's hopeful and it's building. I'm still really in the new stages and still having a state of wonder every time a good result comes by. But that's kind of like the fun part.
it's so rewarding too, right?
Yeah.
No team, it's just you, right? So
It's just
success or
me.
failure, it's all
It's
you.
all me.
I remember that acutely getting started. I remember the first time someone gave me a check, I was just felt like the biggest fraud ever, right? That I'd somehow tricked them into paying me for something that I wasn't, qualified to do. All that training years later, so expensive and things like that. But I still felt like, wow, it was just unbelievable that someone was paying me money for that.
Yeah.
So I remember that acutely.
Thank you for saying that because same. It's like these people are giving me money and I'm like, really? But people are also getting better, which is fascinating and very rewarding.
Do you mind? I know it was a little bit harrowing your first Psalm acupuncture treatment. That's a tradition I practice in, and
Yeah.
that's how I met you at a workshop for the Psalm acupuncture. I know
Hmm.
you recently did your first Psalm acupuncture treatment.
Hmm.
Uh, it's is it still too fresh? You don't want to talk about it, or are you okay discussing that
I was waiting
treatment?
for you to ask me about this.
Okay.
Oh boy. Not because I want to talk about it, but because I knew it was coming. Yeah. Let's see how I can present this to preserve confidentiality.
Yes, that's important. And let me preface this with one time I wrote a Journal of Chinese Medicine article about a case of metaraja that I just could not help anything I tried to do. And I ended up having to take that case to one of my teachers that solved it immediately within a couple of days. I think this is super valuable. I felt super vulnerable
Hmm.
writing that journal article, but my hope was that somebody in the future, if they get into the same type of clinical thing, hopefully that will help. So yeah, in the spirit of that, yeah, if you don't mind talking about it.
Okay. In the spirit of vulnerability, here we go.
Yes,
So
and
this
helping
person,
colleagues.
yeah, this person came in mid 60s, pretty robust but complex, several complex health issues coupled with a lot of loss over the last year. And the main complaint was what they described as an idiopathic neuropathy. They actually described it as a genetic neuropathy. And kind of switched that in my own mind to idiopathic. And I had since been asking him to get the information from the doctor coming in for treatment for pain. He was having a electric shock like pain down the gallbladder channel and somewhat into the stomach channel. And it was intermittent and often it was shocking literally to him. And he was numbness in the bottom of his feet. So that was his primary complaint. And so I had treated him, I think, for 3 weeks using TCM acupuncture and wasn't really making a lot of movement. And there was some irregularity with when he came because of just issues that he had getting to the office due to the pain that he was having. And then he came in and I had mentioned to him some because I thought, he seemed like the type of person that would, I was building enough of a rapport that I was feeling the courage, like, okay, I think I can do it with this guy. So I talked to him at length about it and he was amenable and he's like, yeah, at first he actually wasn't and said, no, that doesn't seem like a good thing to do. So I said, okay, fine. We carried on. And then the next time he came in, he said, no, we need to be more aggressive. Let's try that 4 needle thing you were talking about. So it's like, okay. And so based on his symptoms, which goodness, I had my notes, I could tell you more details, but based on his symptoms, it was like a toss up between a lung excess and a stomach excess. And because he had I remember a lot of rising symptoms, like he had some acid reflux, he had um, things going upwards, and he wasn't like a Sanjiao excess type person, so it wasn't like that flushing up. But I felt, and he had flat venars, and trying to remember because some of his pathology was along the stomach channel. I was like, okay, we're gonna try to, and he had high blood pressure, so I was like, let's see how this goes. And so I treated him on his left side. I think he was having more pain on his right side at the time and sent him home. But he got up and what he said actually after the treatment was, my feet feel like water balloons. And I was like, okay. I didn't quite know what to say to him about that. I said, well, let's see what happens. And then so he goes home and I go about the rest of my evening. He was my last patient of the day. And so I go home and go to sleep when I wake up in the morning. And I was in the process of learning that the Gmail was dumping emails into my spam from certain people. And I hadn't quite realized that. So I was in the middle of a
No.
phone. Yeah. And so I was in the middle of a phone call and it was like 2 o'clock in the afternoon. And I was trying to troubleshoot. It was like, I don't know, I think it was QuickBooks or something. I was on the phone and I just was clicking through my email because they were telling me to check my spam because they were trying to send me something. And I saw this email from this patient had emailed me at like 11:30 that night and was like, I am in excruciating pain. I can't sleep. And I'm thinking to myself, I'm like clutching my pearls, right? I'm like, oh my God. So I email him back real quick because I'm on the phone, like, how you doing? And then as soon as I got off the phone, I called him. And he's like, yeah, he's like, it is the worst pain I've ever experienced in my entire life. I am in so much pain. I was like, it is awful. And I was like, can you come back in? Because I thought, oh God, I just messed him up real bad. Like I was feeling awful. I panic emailed you. It's like, what do I do? Oh my God. Because when we were on the table and I was looking at him, he looked calm. He looked good. He didn't have any
Hmm.
of the weird blotchy that you're supposed to look for. He couldn't come in that day. So I said, will you come in the next day? And he said, yeah, I come in the next day. So he did. And I was like, I'm not even going to charge you. I was so mortified. So he came in and he got on the table and he was in a different treatment room. And, he was talking about it and what was happening. And he said the pain, like he said, it was within like an hour or two of his getting home, the pain just intensified. Like it went like through, like beyond 10 out of 10. And it was all through the night. It was feeling like that. And like he was having different sensations in his feet. And to make a long story short, I got him on the table and I put my hands on his feet just to like, I don't know, make a connection. And I noticed when I touched him that his left foot was very hot, conversely to his right, and that wasn't the case the 2 days ago.
Mm,
And so I, crank up my light and I pull up his pant legs, and I noticed that he had, because I'm not a doctor, I couldn't diagnose, but symptoms consistent with a pretty raging cellulitis
mm,
all the way up his legs. And what was interesting about that is that it was running up his spleen and his stomach channel primarily. And so I asked him, I was like, do you notice anything about the color of your legs? And he sat up and he looked at, he's like, no, I didn't really. And I was like, I want you to look at this. And I was showing him. And as I'm noticing, he's got more swelling on that side. So I'm like, and he had a history of having osteomyelitis and recurrent infections. One of the things that was happening is slow healing wounds. And so he was treating a wound on that toe that I had also been sort of paying attention to. He always had it wrapped very particularly, so he hadn't wanted me to unwrap it before.
mm.
So I had assumed that might be the source of what the infection was. I was like, I really think it's, I was like, okay. I was like, I think with this going on, like you need to go to urgent care. And he's like, you're not going to treat me with acupuncture? And I was like, no, sir. I was like, I think you need to go to urgent care, like right now. And he was kind of dilly-dallying, and I didn't want to scare him, but I just, I was like, as a nurse and someone who cares about you, I think it's really important that you be evaluated by a Western provider for this. And I sent him off to urgent care, and then it was 4 or 5 days I didn't hear from him. So there was like the panic part of me was like, oh God, did he die? And then there was the
Yeah.
logical part of me that was like, he probably got admitted to the hospital. And he did. And he had a pretty severe cellulitis. It was caught before it went systemic. He had sepsis in the past from this kind of thing. And they had found some more osteomyelitis. So he got that treated. And since then, I have heard from him periodically, like he'll call to check in. He's having a little bit of stuff that's going on, is what he said. And he's waiting on insurance because I'm trying to panel with his insurance. So yeah, he's working through it right now. But that was a crazy experience, I'll tell you. Definitely made me a
Yes.
little gun shy. I was like, oh God, and then trying to figure out what happened, you know? What do you think happened?
I remember guaranteeing to you that not all cases would be like this, treating
Yes.
some just that stuff out of the gate. I think you and I went back and forth on this a little bit. And right away, because you presented the case much more detailed to me, that I felt like you'd done the right thing with Sam, and I thought maybe something else was going on. And then I was emphasizing to you, patients love to blame acupuncture for every single thing,
Mm-hmm.
and then attribute any beneficial things to their body just being fine, right? So
Mm-hmm.
I said just be cautious about that, because you and I were discussing at that point, if you needed to counterbalance that, you'd supplement stomach. Is that right?
Yeah, I supplemented stomach.
And so we were talking about, should you supplement lung? And
Mm-hmm.
then we really felt like it wasn't a wrong treatment once we discussed over and over again, especially his face responding well, and that maybe something else was going on. So this
Mm-hmm.
was an extremely difficult case to navigate, especially as your first one,
Yeah.
because we had two parallel things going on, using a new
Mm-hmm.
system and then an undiagnosed other pathogen that
Yeah.
was virulent and just came to the surface of something like that. So yeah, again, my sense about that case, again, we never know, be certain about anything in clinic, is that you diagnosed and treated correctly, and then just that infection was just raging there. So it just come to the force.
You know what was wild though, Toby, is that it wasn't there. Like I didn't, I've got good assessment skills as a
Mm,
nurse, and I hadn't raised the entirety of his pant legs to treat because you didn't have to. But his feet, there was no sign of infection that I saw or felt with touching him, And then 2 days, like that night, and then I saw him 2 days later, like it's almost like it brought it to the surface. I think you mentioned that that could happen, that maybe that the acupuncture could actually have brought that to the surface. Is that right? Am I understanding correctly?
yeah, it's definitely possible, right? But I think it's unlikely. I think that was just kind of a course of how everything was going for him. You did a powerful intervention for him, but I still feel like your diagnosis was correct. So I think it's unlikely that needles actually caused that.
Well, I know it didn't cause the infection. I
Mm,
just wonder if it, moved the chi and the blood into those meridians so powerfully that maybe it brought his ability to sense the infection to the surface. Because of the neuropathy he was feeling, he wasn't able to have a lot of sensation in the extremities that we would consider like, normal or what you're supposed to have there. he wasn't aware of it. I don't know. It's
That's
just
quite
something I've been mulling it like around in my
yeah,
mind even still to this day.
that's quite possible, right? That might have been protective for him. Like he
Hmm.
could actually sense the pain sensation.
Yeah.
Yeah, so again, that's what I said, two parallel tracks we're discussing right now, the pathology there, and then
Yeah.
also was your SOM diagnosis correct? I feel like the SOM diagnosis is correct, so it's possible that yeah, you unmasked all that, especially by supplementing stomach, taking all that dampness off there, so the patient can
Hmm.
actually sense that.
Yeah. Wild first experience on my own.
Okay. I guarantee, and you're finally you're embedded with school and everything like that out on your own, and then this is your first presentation, so I guarantee
Yeah.
it'll be easier. There will be future cases that'll be more difficult than that, but at least you'll have a little bit of golden time now as a new practitioner. There's always a little
Hmm.
something. 6 months, 9 months, everything will go pretty well, and then as long as you keep learning, you can keep extending that golden period.
Hmm.
Otherwise, if you stop learning, then that you can't extend that.
I don't know that it's possible to ever stop learning this medicine. I feel like it's
Yeah.
bottomless.
Yes, if you're bored in Chinese medicine, something's wrong with you.
Yeah, agreed. Goodness. Have you ever had a case like that where things just went wildly sideways on you?
Yes, frequently I've had that.
And how do you, so for me, my impulse was, oh my God, I have to fix it. And I took all of the responsibility on myself and like I wasn't even going to charge this person. So like, how do you, because I know that's not sustainable to do either. And I don't know that I would do that now. It's like that not that I've been practicing forever by any means, but now that I'm a couple of months in and I've seen enough patients on my own to kind of, I'm starting to be like, okay, this is how this is working. How do you handle it when things go super sideways?
Yeah, I think you have to understand that the patient's paying you for your best possible treatment, right? So that's what you gave the best possible treatment. And like I said, it's impossible to say for sure, but you probably helped that patient, and then for that patient could feel that before again major problems. I mean, they could have been even more infection before they actually felt it. So it's possible you really helped them, but still your intention is to help the patient as much as possible, and that's what you charge for. You can't charge for results. Like you can't give like a discount if everything miraculously, or you can't charge extra if something miraculously moves forward. You can't charge them for 10 treatments that they probably would have needed, and then like that. But also those difficult cases, right? You have to just charge for your best possible intervention that you can do. So I think that's reasonable, especially in that case, right? You're so unsure about things and things like that, not charging for that. But going forward in the future, I think you just have to charge for this is the best possible intervention you can make, and you don't charge extra if it goes miraculous, and you really can't charge less for if it's a little bit slower than expected, because there's just you don't have full control over that. You can't diagnose and treat perfectly every time, but you can get better and better as your career advances.
Yeah, I feel that more now, especially after spending the weekend in North Carolina at Taoist Traditions. One of the main themes that was like a thread that moved through the whole weekend was that we can't take the personal responsibility for the healing of the person for better or for worse. That it's not our job to fix the people and it's not our job to put that on ourselves. We work with them and we facilitate person's healing. I think that's important to remember for better or
Yes.
worse. I tend to be very blameful of myself, when things don't go well. So it was sort of a balm to my spirit.
Yeah, it's your responsibility to do your best, and then after that, you're free of that, from
Hmm.
my standpoint. And then yeah, you just work with that as best you can. My
Hmm.
teacher, Dr. Wu, she always, anytime the patient complimented her, she had some amazing and miraculous things. She did a lot of infertility. So people that just had no chance of having a baby, full 9 months, natural birth, everything, a healthy baby and things like that.
Hmm.
The patients would just effuse praise on my teacher, Dr. Wu, and she always responded the same way. Great job, body, right? To redirect
Yeah.
to the patient's body that actually did everything, right? Of course,
Yes.
we can have some influence. We can try and get it going in the right direction, but the real miracles come from the body, and
I agree.
if acupuncture can do that, so yeah, I thought that was a nice way of sidestepping all that. And then
Hmm.
also, if everything's not going exactly how the patient would like, everything's not resolved immediately, you can't take full responsibility for that. So the healing and then the maybe slower treatments, you can't take full responsibility for that.
Hmm.
Both instances, right? You just keep doing the best you can. And this is amazing medicine, but you can't will things to happen. You just have to do whatever your skill set is in that current moment when you meet that patient. just do the best you can with that. And then it's a tall order, but do the best you can. Just let that go. Let those results unfold.
Yeah. Be as present as possible and surrender. Right. But then I wonder, too, like how you reconcile clinical thinking around that too, because you want to be diagnosing and treating correctly. So it's like how, parsing out the difference between like, is it my diagnosis and treatment? Is it the patient? Is it both? Because I remember in the course that I took with you that you had mentioned that like it's the system that works, that usually it's paraphrasing, I'm not quoting directly, but like if the system works. And so often it's like the practitioner. How do you say it? You
I'm not
mentioned
sure what you
you're
mean.
talking about that with the SOM system, that like the system works. So usually if it's not working, it's usually because of like the error, not the error of the clinician, but it's usually not, I'm not finding my words well in this moment.
I remember what you're saying. Um, I really, this is my experience with the SOM system.
Mm-hmm.
Originally, when I learned it and I couldn't get clinical results, I would blame the system. And now I realize the system is so sound and can generate so many good clinical things. Mostly I blame myself, right? If I can't use the system properly.
Mm-hmm. That's what it was. Yeah.
So that's a key thing too, right? Is if you get a good solid system, then it's really on you to do the best you can. And then as you work with that system more and more, it reveals like how powerful it can be when you have certain insights with the patient, right?
Mm-hmm.
So yeah, I'm just always trying to get a little bit deeper understanding of the patient in front of me and then see if I can match my understanding of the system together. It's difficult when you start and it gets a little bit better all the time as you go forward, but at least for my case, it's never close to just super clear. There's always a little bit of everything's a little bit unsure when you go to apply it in clinic. But
Mm-hmm.
the nice thing about having a good system, you can test your ideas and then hone your diagnostic skills over the years.
And hopefully not have too many crises on the way.
Right. Yeah.
Right.
But that's why especially like you presented your case, right? Because I still don't feel like you caused that crisis from your acupuncture. So you got to learn about like the other factors that are going on besides the body, besides that acupuncture one. And then also, yeah, to learn how am I going to apply this going forward? I have to consider all these other things too. So it's like double, maybe even triple learning with one case. So
Sure. I'll never forget it. I'll tell you
okay.
that.
Okay, great. And thanks for sharing with everybody too. Okay, anything else you want to discuss?
Oh, I did. You had mentioned once before that your teacher saw 150 patients in a day and that you interned with her during this time. And so I'm curious how that was possible and how she did it and kind of person that she was
Yeah,
or
it was
is.
amazing.
Is she still with us?
Yeah,
Okay.
she's semi-retired now.
All right.
But yeah, it was she had pretty amazing. So I was mentioning before, my teacher, Dr. Wu. So yeah, how she would do that is she's she was several decades into her practice, and she just honed everything to be. She was a master face reader and master pulse reader. So between those two things, she would come in within a few seconds of looking at the patient's face. She has an idea and then checking pulse, and then she's ready to go. So she was a good acupuncturist, but especially good at guiding the patient with things in their lives. So she would come in and within just a few seconds say something really profound to the patient. And based on face reading and pulse reading, Dr. Wu would just transform into anything that that patient needed. So I was there for 4 years. The final day when I left, she allowed me to shadow her for the whole day. And it was absolutely amazing how she would just come into the room, transform into whatever the patient needed, and treat and then leave and then go on. It was like dizzying. She would come in, be so grandmotherly to some patients, right? Just
Mm-hmm.
nurturing and taking care of, and then so harsh she'd be in the patient's face, yelling at them. Whatever the patient needed to advance their health, she would just transform into that with her words, with her advice, with the needles and things like that. So
Mm-hmm.
it was a short period of time that she would be with the patient, but it was so intense and oftentimes, really profound to the patient. So yeah, I saw a whole bunch of amazing things in that one day, but it was dizzying
I
how,
bet.
how she was able to do that. And then just logistics of all that. She had a staff of 10 really well trained people. So she would put needles in, they'd be removed for her, check it, so she would just come in, diagnose, treat, say something profound, move on to the next patient and route it around like that for an entire day. It was exhausting. Those are long days, 12, 14
Yeah.
hour days. But yeah, that's she'd honed herself to just be a pure instrument of diagnosis and treatment.
That's incredible.
Yeah, it was amazing to watch.
Yeah. Especially sitting over here when I have 6 patients in a day and I'm like, oh my God.
Yes.
It's because of
So
the I aspire to some level of mastery. I don't know that I would ever get to 150 patients. I don't know, man. I think about max patients per day and 7, 8, 9, 10. I don't know.
yeah, well, you'll see, right? You'll see how everything goes soon, especially with your clinic starting to get up and going. So your problems now is not enough patients, and then for about a week and a half, you'll be happy. You'll have enough patients, and then soon you'll have too many patients, and you have to manage. So that'll be a new problem for you. If your problem
Yeah.
now is not enough patients, you'll be golden for about a week and a half, and then it'll be too many patients.
I'll be lucky to have that problem.
Yeah. But anyways, but there'll be new problems, right?
Yeah, true.
And then you have to need staff, and you'll need, so it'll be new problems going forward. Yeah, especially a successful clinician, right? People are going to want to come see you, so you're going to have to manage that somehow.
And how many patients do you see every day?
I had some health stuff, so I used to see up to 30 patients a day, and now I try to cap it at about 16. That's my real cap.
Hmm.
I just got, I think I'm going to be a little bit over that tomorrow. I'm going to be going out of town soon. I've got a patient I've been seeing for infertility, and then she's now coming to term, and they're going to induce soon. And so before doing that, she wants to come in for acupuncture. So we just added that to the schedule tomorrow, right? So it was already 16, so I think that's 17. And then this is monastic tradition, so I always see monks. So I've got a really high level monk coming tomorrow too. So I think I'm at 18, but my theoretical limit's 16. I don't want to do 30 patients a day anymore. I think it's a little bit too much for me.
Yeah, I can see that.
What's the ideal number of days to see patients per week?
Currently, I'm working 4 days, but
Hmm.
if I could, paint the ideal picture, it'd probably be 3.
Yeah, I really feel like that's ideal. That's Dr. Wu, I was telling you, those 150 patients a day.
Hmm.
That's not like 5 days a week. She would see patients 3 days a week. Um, because after seeing 150 patients a day, transforming yourself into being all those amazing things, right? The last
Hmm.
thing you want to do next morning is to see a patient and listen to their blues. Um, yeah, so I know a lot of successful clinicians. I think maximum they do is maybe four or something like that.
Hmm.
Usually three, four, five, you could maybe manage it, but I know a lot of people that try and do more than that. And I think it's too hard on the system, right?
Hmm.
Especially if you're really bringing yourself to the treatment. I
Yeah.
think you have to have a little bit of rest. You have to have some time for self-cultivation, some exercise, some not working at that intense level.
Hmm.
In order to stay at that intense level, you have to come down sometimes too. For me, I match Dr. Wu's, so I see patients just 3 days a week now.
Yeah. I like that. And that'll be something I can aspire to in the future. Once I've established myself and figure it out, go down to 3 days. That
Yeah,
sounds very nice.
yeah, I think it's a really nice rhythm. But I think 4 days a week, I think that's fantastic for you right now. The thing you have as a new practitioner, the best thing you have is availability, right? That
Yeah.
you can offer to the patients availability. So
Yep.
I think that's fantastic to get started. But just you want to be in this for the long term, a couple of decades practice, right? So
Hmm.
I think that's the way to do it. Hone down to I like 3 or 4 or something like that. But and then try and make them intense days, like Dr. Wu do 12, 14-hour days. Doesn't have to be like that. But if you can put everybody into 3 days or 4 days, it's much better than having them trickle in for 5 days or 6 days.
Yeah, I can see the benefit of that. I worked, when I worked in the hospital,
Mm.
I definitely felt better working longer shifts, less days per week. So that rationale also seems to fit here for that same reason. Because once you're there, you're there. You're in the clinic, you're at the hospital, whatever, you're there. You might as well just stick it out.
Energy's up and you're in
Energy's
that
up.
mode.
Yeah, you're
Yeah.
there. You got your practitioner hat on.
Yes.
Yeah,
All right. I was going to ask you one more question and then wrap it up for today. Is that okay?
sounds good to me.
I know you just took your boards not too long ago.
Hmm.
So I was going to test if you still have some
God.
knowledge.
Okay.
Are you ready? Where is
Oh, God. Okay.
Huang Mun, urinary bladder 51?
Oh my God, Toby.
First question, is there a urinary bladder 51? Do we have that point?
I think so.
Okay, okay, good. Okay,
Yep.
so that's good.
Yep.
And where is it located?
It's on the back somewhere. It's on the back, low back,
Okay, good.
outer bladder line.
Good. Can you be any more specific with any vertebrae?
Have to do math. Oh no.
Okay.
Yeah, it's
I want to make sure that you forgot these things as quickly as I did. So I wanted
Lord.
to ask you that.
Okay. Thanks for that, Toby. Humbling. Thank you.
I had to look it up. It's a T.
Okay.
All right.
Okay. Yeah.
All right.
Are you sure?
No, I'm not sure about that.
Okay. I was like, that feels high. I think it's lower. Oh my
It
God,
is.
do we have to
It
pull
is.
out dead
It
men?
is. It
We're
is
really
lower.
gonna
It's not. It's
make
not
this
T1.
public.
I said T1. I apologize. It's L1. I'm sorry.
Okay. All right. See?
Let's recap this. There is a urinary bladder 51.
Yes.
Long Mun, it's at L1 at
Yes.
the outer UB show. Okay. All
Mhm.
right. I'm glad you forgot it immediately.
Thank
I
you.
think I think that's good use of your brain, right? Just jettison all that stuff you had to have for
Just
boards.
gone. Just put it back in the books where it belongs. You can look it up when you need it, right?
That's right. I looked it up and then said the wrong thing. So
Yeah,
sorry about that.
that's okay. I, I feel better about it.
I couldn't even remember after writing it down. So all right, Angelique, if you're up for it, let's continue our conversation going forward, and we'll just continue discussing, like we were talking about before, our field itself, right? It's
Hmm.
endless of things we can discuss. So
It's
let's
true.
meet again sometime soon and continue this discussion. All right?
That sounds good to me. Are we going to invite folks to put their suggestions and comments if they see this of what they'd like to hear about?
Yeah, that would be great.
Mhm.
If anyone does run across this and they want us to discuss something in the future, yeah, if they could put any ideas they have in the comments, that would be great. And if you really enjoyed this discussion, you can like it. If you really didn't enjoy this discussion, Angelique and I promise we'll do much better next
We'll
time.
do better
Okay.
next time.
Everyone take care, okay?
All right. Bye, everybody.